over this county.
Oh, they're crazy. We had one again last night.
Yeah.
And the dogs, not one single dog had any idea.
Uh-oh.
We're live
No
now.
warning.
All right, so all of you who are tuning in, we apologize. We were working on technology this morning, and we will call the Public Health and Human Services Board to order at 8:33 a.m. Welcome, everybody. We have lots of people in here this morning. We will start out with why we're having this meeting, the way we're having it on a Zoom and or call-in. It has been determined that an in-person meeting is not practical or prudent because of the COVID-19 pandemic and related peacetime emergency declaration made by Governor Walz in accordance with Minnesota Statutes Chapter 12. We have ensured that all members of the body participating in the meeting, wherever their physical location, can hear one another and can hear all discussion and testimony offered today. We have also ensured members of the public present at the regular meeting location of the body can hear all discussion and testimony and all votes of the members of the body. We have urged the public not to attend this meeting in person because of the COVID-19 pandemic and have ensured that members of the public can view and monitor the meeting remotely in real time by broadcasting the meeting on the Cook County website. Due to the COVID-19 pandemic, we have determined that it may be unfeasible for the county auditor, county attorney, county administrator, and board of the commissioners to be physically present at the county boardroom at the Cook County Courthouse. All votes will be conducted by roll call so that each member's vote on each issue will be identified and recorded. And if you can hear any background sound, I just want to tell you that that is my 4 children. That would be 2 labs and 2 chihuahuas. One is a Labrador puppy, so I apologize. I'd like to thank the public for being disturbing during meetings because I've learned how to completely ignore other sounds. We will start with the consent agenda, which includes the approval of this agenda and the minutes. Would anyone like to make that motion?
I'll make that motion.
Thank you very much, Commissioner Bersheim. Can I get a second?
I'll second.
Thank you, Roger. We will do a roll call. Aye or nay is the response. Commissioner Storley,
Aye.
Commissioner Bersheim,
Aye.
Commissioner Mills,
Aye.
Andrea,
Aye.
Roger,
Aye.
and I am also an aye, so that is all ayes for that one. Thank you all very much. We will move on to the staff report. This morning we have Martina Johnson. It's all yours.
Hello, good morning. Thank you for having me today. My name is Martina Johnson. I'm the Adult and Home and Community-Based Services Supervisor with Cook County Public Health and Human Services. And along with me today are Olivia Bonander and Lynn Wright. They are both social workers with the Adult Services team, and they also are adult protection workers. Morning. So I am going to try to share my screen here, and let me know if you do not see my presentation, please. Are you able to see that?
Yes.
Okay. Cook County Public Health and Human Services has a role in creating safety for vulnerable adults by connecting them with resources and supportive services. PHHS is also responsible for investigating reports of adults who have been maltreated. It is the statutory responsibility of Cook County Public Health and Human Services to provide adult protective services and to respond to reports of suspected maltreatment of vulnerable adults made under the Vulnerable Adult Act. Adult protective services include intake, response to emergency adult protective service notifications, investigations, and safety planning to remediate and prevent maltreatment experienced by vulnerable adults. How do we at Public Health and Human Services receive reports of maltreatment? So prior to 2015, July 1st, 2015, Reports came in a variety of different ways. They might have been made directly to Health and Human Services. They might have been made through law enforcement. They might have come in to another provider that we work with. And the state determined that it was really difficult to track the reports that were being made because they were coming in so many different ways and they weren't always getting recorded. So the state of Minnesota created the Minnesota Adult Abuse Reporting Center, or MARC. And all adult maltreatment reports now go through that centralized call center. It's staffed 24 hours a day, 7 days a week. The number is 844-880-1574. Mandated reporters, which I will explain a bit later, can submit reports online through the link here, or they can go to mn.gov/DHS/report adult abuse/. So when someone reports maltreatment, it will come in through a system that we use, the county uses, and it's used across the state of Minnesota. So we get notification that the report comes in. And we have laws, that guide our work. In April 1980, Governor Al Key signed Minnesota's Vulnerable Adult Act into law. The Act's definition and related laws are listed below if you are interested in learning more. 626.557 is the reporting of maltreatment of vulnerable adults. 626.5571 defines the multidisciplinary adult protection team. 626.5572 gives definitions. 626.5573 gives negligence actions. Department of Human Services, or DHS, rules govern the investigation and reporting of maltreatment of vulnerable adults and some aspects of the emergency and continuing protective social services required to be furnished by local social services agencies under the Vulnerable Adult Act. How is a vulnerable adult defined in Minnesota? So you might know of someone and think that person is vulnerable, and they might be by the definition of just being a vulnerable person. But the law has very specific categories that an individual must fit into one or both of these in order for us to be able to open up an investigation into reported maltreatment. The first category is a categorical vulnerable adult, and that's any person 18 years of age or older who is a resident or inpatient of a facility or receives services from a provider listed within the statute. And this can include foster care, assisted living services, home care, so skilled nursing services, etc. I always like to remind you when I give this presentation that anytime you are an inpatient in a hospital, you are protected under the vulnerable adult statute. You are considered a categorical vulnerable adult. So if anything happens to you while you are hospitalized, it can be reported and looked into by county social services. The other definition is a functional vulnerable adult. And that's any person 18 years of age or older, regardless of residence or whether any type of service is received, who possesses a physical or mental infirmity or other physical, mental, or emotional dysfunction that impairs the individual's ability to provide adequately for their own care without assistance, including the provision of food, shelter, clothing, healthcare, or supervision. And because of the individual's dysfunction or infirmity and the need for care or services, they have an impaired ability to protect themselves from maltreatment. And this is the category that's a little bit harder for us at times. It's our gray area to determine whether or not someone meets the definition of a functional vulnerable adult. Because our volume of reports aren't as high, I think we often err on the side of caution. And if we feel that someone is vulnerable and meets this definition, we will likely rule it in, whereas other larger counties might be more likely to if someone doesn't quite fit this definition, they might not investigate. What is maltreatment? So Minnesota Statute 6265572 defines 3 types of maltreatment: abuse, neglect, and financial exploitation. Abuse is defined as physical, sexual, or emotional. Physical abuse means inflicting physical pain or injury. So examples include pushing, pinching, shoving, burning, biting. The inappropriate use of medications and physical restraints can also be regarded as physical abuse. Sexual abuse may include touching, fondling, or any sexual activity when the vulnerable adult is unable to understand, unwilling to consent, threatened, or physically forced. Emotional abuse may include verbal assaults, threats of abuse, harassment, and/or intimidation. Keeping the elder from others as a means to manipulate, or the vulnerable adult. For example, if you don't sign the house over to me, you'll never see your granddaughters again. That might be considered emotional abuse. Neglect. Caregiver neglect is defined as the failure of a caregiver to supply a vulnerable adult with care or services, including but not limited to food, clothing, shelter, healthcare, or supervision. Self-neglect can occur when a vulnerable adult demonstrates an inability to adequately care for themselves in a manner that maintains their physical or mental health or safety. Financial exploitation is the 3rd type of maltreatment. That may include theft or withholding of money or property, and or use of the vulnerable adult's money or property not for the vulnerable adult's benefit. What are the signs of maltreatment? Signs of abuse might be, and this would include physical, sexual, or emotional or mental abuse. Signs might include bruises, pressure marks, broken bones, abrasions, burns, the vulnerable adult's refusal to seek medical help for injuries, nonchalant attitude toward any of these injuries when confronted about them, odd changes in behavior. So maybe they were someone that was regularly interacting with friends, and now all of a sudden they have stopped doing so, and this is a major change in their behavior. Strained or tense relationships, unresponsiveness, and dislike for communicating with others. What are the signs of caregiver neglect? Visible weight loss, bed sores, lack of supervision when medical professionals have indicated it is necessary. So for instance, someone who their doctor has indicated that they are in need of someone to be with them at all times, and their caregiver is not providing that level of supervision, that could be considered neglect. Also, evidence that basic hygiene needs aren't met. For example, vulnerable adult is not regularly bathed or dressed in clean clothing. What are the signs of self-neglect? Refusal to seek medical attention when needed, visible weight loss, sunken eyes, lack of basic hygiene, water, food, and or clean clothing, unsafe home setting. For example, someone that lives in a setting where there's hoarding taking place, and that hoarding has risen to the level where it's blocking entrances and exits, or there's rodent infestation. That could be considered self-neglect. And oftentimes when an individual might be engaging in self-neglect, we're looking at someone who is experiencing some cognitive impairment, so maybe some dementia or other cognitive changes. Signs of financial exploitation might include unusual ATM activity, large withdrawals from bank accounts, signatures on checks that don't match the signature of the vulnerable individual, or life circumstances that don't match up with the elder's or vulnerable person's financial assets. So maybe you have a friend who has always been able to go out to lunch with you, and she always insists on paying, or she always is able to take vacations or buy what she needs. And all of a sudden she's telling you, I just don't have the money. I don't know where the money went. Might be a good time to look into that. So I talked earlier about mandated reporters. And I just wanted to touch on this because it's just really important that people who are mandated to report are aware of who they are and the importance of reporting. Hopefully, all people who witness or suspect maltreatment will report the abuse. Mandated reporters are a special group required to report maltreatment. They are professionals or professionals delegates identified by law who must make a report if they have reason to believe that abuse, neglect, or financial exploitation of a vulnerable adult has occurred. So this includes doctors, nurses, social workers, law enforcement personnel, dentists, educators, or anyone employed in a licensed facility. I think if you are a mandated reporter, it's important to know that don't assume that a report was made just because people might be aware of it within your agency. It's really important that mandated reporters report allegations of maltreatment. I think also sometimes with law enforcement, if they have encountered a situation and they've made a police report on it, that's not the same as making a MARC report. We need the MARC report in order to begin an investigation. Mandated reporters can only report what they know. They need a good faith, honest belief that abuse or neglect is occurring. Minnesota law specifically provides immunity from civil or criminal penalties for reports of suspected abuse or neglect made in good faith, whether mandated or voluntary. This is basically to say, if you suspect maltreatment is occurring, don't be afraid to report it. If it turns out that it's not maltreatment, that maybe you were only seeing just the tip of a situation and what you saw was concerning, but the rest of the story is okay, the person's okay, they're being cared for. Don't let that stop you from making the report and just having us connect with the person. Our goal is always to come into an investigation or a situation not from a place of penalizing people, but more of a place of introducing ourselves, learning about the situation, asking what services might be in place, asking what does the person need to make things better for themselves. Sometimes people just say, we're fine, leave us alone. That's fine too. But we're always just coming at it from a place of trying to be respectful and not trying to, go in, and we're not there to try to get people in trouble. We're just there to learn more and offer help. So how do we respond to reports of maltreatment? How does our agency respond? If the VA is not in need of immediate care or protection, but is allegedly abused, so if there's an allegation of physical, sexual, or emotional abuse, we need to begin that investigation within 24 hours if we screen it in that the individual is a vulnerable adult. Within 72 hours, if the VA, the vulnerable adult, is not in need of immediate care or protection, is not allegedly abused, nor has allegedly been neglected, the investigation shall begin. So that would be an example of like a financial exploitation allegation. We would start our investigation within 72 hours. Within 5 days, we need to notify the reporter of the initial disposition. And that's basically to say, yes, we have decided that we're going to investigate this, or no, we're not going to investigate this, and these are the reasons. Within 60 days, we need to complete our investigation and have a final disposition. Sometimes investigations take longer and we just extend our time, but we need to try to have it completed within 60 days. So the outcomes of investigations substantiated means that we have determined that an act of maltreatment has occurred. False just means that we have not determined that an act of maltreatment occurred. Inconclusive means that We might think that something happened, but we can't necessarily prove it. Some allegations result in no determination, and that's just to go back to the investigation is not possible because we are not looking at a vulnerable adult as the alleged victim. Investigations can result in criminal charges, reports to licensing certification boards. They can interface with the Minnesota Licensing Agency's Department of Human Services Office of Health Facility Complaints. And most of the time, investigations result in referrals for services. What are some of the things that can be done to reduce maltreatment? If you have vulnerable people in your life, have them stay nearby if you're able to, or have them stay near a close family member. And the reason that this is so important is that it allows you to offer assistance when you notice they need it, or it allows them to reach out to you if they feel they need help. It just allows that relationship to be able to take place. Call or visit a vulnerable loved one as often as you can, helping them to see you as a trusted confidant. A lot of times there can be shame around these situations. So for instance, if someone is being financially exploited, say they fell for a scam, there's a lot of shame around that, or there can be, and it can make people really hesitant to reach out. But if they see you as a trusted confidant, they know that you're always there to help, they might be more likely to reach out to you. Make sure the vulnerable people in your life are aware of current scams or solicitations so that they're less likely to fall for them. So talk about them, talk about what you're hearing as being recent scams. Provide a respite break for a caregiver. If you are aware of a caregiver in your life, caregiving is really hard. It's really rewarding, but it can also be draining and difficult at times. And if you're able, try to help a caregiver out. That can really go a long way in preventing unintentional maltreatment. If you are a caregiver, take immediate steps to relieve stress and burnout by practicing stress relieving techniques such as eating healthily, getting enough rest, and requesting help when you need it. Be selective with caregivers. Make sure that if you're setting up a caregiver for yourself or a loved one, that you're really taking the time to learn about their background, talking with them, really trusting your gut as to how you're feeling about them being with your loved one. This last part here, I really like to talk about every year. And these are just some principles of adult protection. So when interests compete, the adult client is the only person we are charged to serve. And this is Health and Human Services, the adult protection team. The adult client is the only person we are charged to serve, not the community concerned about safety, the landlords concerned about property, citizens concerned about crime or morality, or families concerned about their own health or finances. Our focus is on that adult person and what's going on in their life and the circumstances surrounding it, and what we might be able to do to assist them. A person can choose to live in harm or even self-destructively, provided he or she is competent to choose, does not harm others, and commits no crimes. Freedom is more important than safety. This is really important, and it can be really hard for people to understand if they are really concerned about someone. Why don't you do anything? Please help. We feel that too. We want to help, and it can be really almost impossible sometimes to help if the person has the capacity to be able to make decisions, and they get to choose things that others might not agree with. And in serving the adult client, the full range of social work skills must be used to assure the client is fully aware of alternatives, can make an informed choice, and understands the consequences of that choice. So again, how can you report suspected maltreatment? Contact the Minnesota Adult Abuse Reporting Center, or MARC. And that number again is 844-880-1574, available 24 hours a day, 7 days a week. That's it. Thank you. Are there any questions?
If anyone has questions, go ahead and ask Martina.
Martina, I don't have a question. I just have a comment that I appreciate your article in the local paper this past week, because I think it really helps folks to be educated for one thing, and then to understand, and maybe if they have a situation in their family or immediate neighborhood, maybe they will feel more confident that they can reach out. So it's all about education. It's very complicated. We talked about that at AMC yesterday. It's complicated for us in the community, and then to reach out to help our legislators understand this, how important public health is, and the concentration of the different departments. So I always appreciate public health putting things out in the paper. And if you didn't get a piece of the paper, I would recommend, of course, Martina's already given us this update, but it's very good. And there again, appreciate Martina doing that, and Allison to promote that too.
Thank you, Jenny. Go ahead, Olivia.
Another big piece I like to add to is that we don't want things to rise to the level of adult protection reports. There's often opportunities well in advance before a report is made for people to intervene. And that means that there's not an adult protection individual coming into play. So that looks like education and planning for how things can go, especially as we look toward, I know I'm going to die eventually. We all know that we're going to get sick and that life is going to happen. Being planful, being thoughtful, and talking to our family members, talking to our community members about how we can prepare, what services and supports there are available and what is not available in our county as well is so important, so that we can be planful and not have things rise to the level of, we've got to make this immediate report and someone's in immediate jeopardy. So I think that's a big piece, is how can we as a community do better to support one another before things get dire or get to this level.
Olivia, are there any plans for that type of education and outreach? Obviously, it's difficult during COVID, but maybe when that's passed, just to help people so you can help your neighbors and not get to this level?
The big thing I can say, and Martina, you could speak to this too, is I always tell people to just call our agency. You don't have to have a social worker. You don't have to get services and supports to get education about it. Our role as social workers for the community is to provide resources and resource options, not necessarily meaning that you have to get a social worker, but like I particularly love to help people to make plans. How do I want this to go? What are the options for the future? What is a nursing home like? What does the billing look like with that? Because there's a lot of financial pieces and elements that hinder people from accessing services as well. So my big thing is just reach out. We're not here to force you into having a social worker or you need to do this or that. It's more just to offer resources and say, hey, here's how this works. Here's our understanding of the systems. We want it to not be a mystery and for people to feel educated and that they can be supported through these processes.
Okay, thank you. Lynn, do you have anything to add?
I don't have anything, excuse me, to add to that. I was going to comment a little bit about what Olivia already did. Referral for services can happen to the agency by anybody in the community that sees a need. We'd prefer to have somebody know that we might be calling and maybe encouraging that person to work with whoever is seeing a need, and then we can certainly reach out and then and kind of take it from there. But yeah, that's pretty much it.
Thank you. Roger, you had a question?
Yeah, this is for Allison. Would you please send that PowerPoint presentation to the Public Health and Human Services Advisory Council? I think it's something that would be good for them to have. I don't know if we need a presentation, but at least the PowerPoint.
Absolutely, will do.
Thank you.
And Martina, Olivia, and Lynn, please always continue to err on the side of being overly helpful. I can tell you I have a vulnerable adult in my life, and they had 5 MARC reports submitted by doctors, law enforcement, and family in 3 different counties. The person was found walking barefoot in a hospital gown with an IV bag. They were found in the fetal position in a ditch. They were found having 20 cats and all entrances to their home being blocked by hoarding. They stole a neighbor's dog, drove away, and were arrested for drunk driving and theft. And with all of these reports and all of this activity within a 45-day period, no action was taken by any agency. All cases were closed through the MARC system and found to be not anything can do. So Olivia, this goes back to the, how does the family members reach? It was only when a social worker approached them and was attacked and law enforcement was called that some action was taken with them. And I am very happy to report, I can talk about this, I'm very happy to report that this person is doing well and is getting all of the help that they need through the family, and life is getting better for them. But it was a very difficult roller coaster. So anybody watching, please don't give up. Please don't give up on your friends and family and neighbors, and just know that there's hope out there for you. Does anyone else have questions? All right. Thank you guys. Have a wonderful day.
Thank you so much. Take care.
Thank you.
All right, Allison, director's report.
I just want to thank Martina and her whole team for the work that they do for their presentation this morning, and really want to thank all of the partner agencies in the community as well who are involved in preventing adult maltreatment, from Grandparents Human Services, Care Partners, the Hub. We have many, many partners throughout the county who are a part of this continuum of care and supporting vulnerable adults in our community.
And the adult in my life was nowhere near Cook County, or they would have gotten different treatment, I'm sure. Thank you.
Thank you. I'll start with staff updates. We are still working on a staffing solution for daytime crisis response in Cook County. There is the potential for grant funds through the Arrowhead Behavioral Health Initiative to offset the cost. So we're exploring that grant opportunity currently. We are also finalizing a job description for treatment coordination and substance use disorder case management. Again, Sarah Hadley has been performing that role in an out of class assignment temporarily, in addition to her executive admin duties. So we are close to having a position description that can go forward through personnel to be scored and reviewed, and then begin recruiting for that position. We are also working with Pam Dixon in HR on reviewing all public health and human services job descriptions. She's starting with our office support and case aid staff, and is just in the final stages of finalizing updates to those position descriptions. Under items for board action, we are requesting to amend the temporary employment contract with Linda Waterhouse. Through the end of the year, we brought Linda on this spring to provide some coverage during temporary staff absences. For various reasons, she hasn't been able to put in the amount of hours, and we're hoping to extend that through the end of the year just to have additional support. Again, we do not anticipate that total cost exceeding the do not exceed amount that was in the original approved contract, because again, she's the hours haven't been as much as we expected. Really grateful for Linda's support and that she's willing to continue on through the end of the year. For agency updates, our staff are quite busy. In economic assistance areas, we've had an influx of applications over the last 2 months in particular. Annual certifications, recertifications for our SNAP and cash programs have resumed. So for the next 6 months, staff will be completing 2 months of renewals each month as we work to catch up on those recertifications that were waived during the governor's peacetime emergency. So some workload concerns for that team going into the fall and winter, which are typically already very busy months. We continue to see an increase in mental health calls and concerns in the agency. Our social work supervisors are modifying procedures that we put in place this spring to be able to continue to meet with people face to face at the courthouse when that is the best way to meet their needs. They've been quite creative over the last several months in meeting with people out of doors, but again, looking at having a really solid plan in place for the fall and winter when it's no longer safe to do that. We have been using the funding through the CARES Act to add safety modifications within our offices, including installing cubicle walls in some of the shared office spaces. Our staff are continuing to split their time working from home and in the office, with about half of the department in on a given day and half of the staff working from home. But again, by having these modifications in place, we'll be able to have additional barriers and safety measures in place for staff in the office. Staff have been very busy over the last month with back to school, both in terms of as families with young children and in supporting the families we serve in our agency. At the beginning of the month, Social Services Supervisor Grace Bouchard worked with Molly and Brittany in the County Attorney's Office on a training for school staff on mandated reporting for education neglect and truancy. Because distance learning adds some complexities in determining education neglect and truancy. When students are in the classroom, it's much easier to determine. So the training covered the criteria for educational neglect and truancy, and then how to respond to those conditions. So I really want to recognize Grace and the county attorney staff for working with the school to provide that level of support. Grace has also designated social worker Cooper Turnus as the point person for the schools in providing support and resources for education neglect. And the multidisciplinary child protection team met last week, and Grace shared that people are already connecting with Cooper as a resource. So again, thanks to Grace and to Cooper. The multidisciplinary child protection team, adult protection team that Martina reported on this morning, and the multidisciplinary crisis response team do continue to meet each month. So that's a really important way for us to remain connected with our partners in the community. Those are all happening through Zoom. In addition, our public health staff are working closely with the schools in providing support, meeting weekly with leadership from each of the county schools. A frequently asked questions document was developed for families to help manage the volume of questions that were coming in through public health. That document is updated frequently and is available on our Cook County Hub site. Let's see, so our Public Health Fund Committee met several times over the last few weeks to review requests for 2021 funding. Those are the public health grants to community nonprofit agencies whose work aligns with our community health improvement plan. So 8 organizations applied this year, requesting $153,000 in funding. And the subcommittee, again, this is of our Public Health and Human Services Advisory Council, are recommending that 6 of those organizations receive funding this year. We anticipate sending out notification letters at the end of this week, with the caveat that the final funding decision rests with the county board at the point that the levy is set later this year. We've also been working, Grace and I, on the requests for CARES funding assistance for area nonprofits and child care providers. 7 organizations applied for CARES funding for unbudgeted program expenses incurred due to the COVID-19 pandemic. And Grace sent out notification to all of the applicants late last week, notifying them of the funding decision, and have been working closely with Rena and Brady on that process as well. In outreach, we are continuing to promote the community support line as a resource for people wanting to connect with a local trained volunteer for support and connection to resources. We are doing some direct promotion with partner agencies, including through the Hub, home delivered meals, the AEOA food distribution programs, care partners. We're working with the library and are also working on connecting with the chaplaincy. We're also referring people at the point of COVID testing and with the flu clinics. And please let me know if you would like any business cards or flyers printed, and I'm happy to get those to you. We are also promoting in September Recovery Month and Suicide Prevention Month. We are working to get the word out on the Bridge to Health survey, how that's a very important tool for our agency and our community health improvement work. And we're also promoting the flu clinics through the Sawtooth Mountain Clinic. You'll see more information in Roger's report from the PHHS Advisory Council about the flu clinic. We are also actively recruiting for both our Public Health and Human Services and local mental health advisory councils. This is an opportune time to join, perhaps, for people when we're meeting remotely. So encourage people to visit our website or reach out to me for questions about joining either of those councils. As Commissioner Storley mentioned earlier, we both had the opportunity to attend the AMC policy conference yesterday and the Health and Human Services Policy Committee. There were updates on the Blue Ribbon Commission and some of the health and human services waivers that have been in place since the pandemic. There were breakout discussions on COVID response, how agencies are managing service delivery changes. And the theme of concern that I heard from my colleagues and commissioners on the call was how to be prepared for what is anticipated increased needs across public health and human services, despite the decreased resources available to do our work. That's all I have for updates this morning. I'm happy to take questions.
I have a couple. The public health grants, there were 8 applicants and 6 were approved. Do you have the dollar amount for the 6?
So we anticipate granting out the $135,000 that we had allocated.
Okay. And then do you know how much was applied for with the CARES, the 7 CARES applicants?
Oh, I think it was around $98,000.
Okay. Does anyone else have questions for Allison? Right. That means, Allison, you did a wonderful job and no one has questions. It was very thorough. All right. So we do have an item for board action as Allison presented to us, and that is the temporary employment contract with Linda Waterhouse. Would anyone like to make the motion for approval of that?
I will make
Andrea.
the motion.
Thank you.
For
Can I get a
approval.
second? Roger. So we have Andrea and Roger. We will do roll call. Ginny,
Aye.
Myron,
Aye.
Andrea,
Aye.
Roger,
Aye.
Dave.
Aye.
Thank you. And I'm also aye. So that is approved unanimously. And on to committee reports. Dave Mills, Arrowhead Economic Opportunity.
Yeah, I went through my list on the agenda here. I don't think I have any reports today.
Wow.
Yeah.
We're going to be out of here early. So you don't have Arrowhead Health Alliance. And then next is Arrowhead Regional Corrections. Myron?
We have a meeting Friday, this coming Friday.
Okay. And then we have Arrowhead Regional Development. Ginny?
Thank you. We did not meet last month, but we are this month on Thursday. But I will give just a little bit update on the NACO Health Committee that I'm on. What we have been discussing really isn't, there's always a COVID update, but we've been discussing and hearing reports on opioid use, which is down slightly. And e-cigarettes is down quite a bit because young people are living at home. So it's kind of like they can't sneak out their little smokes as easily when they're at home. And also, like Allison said, we've attended the AMC policy, the AMC Health Policy Committee. We met yesterday. We'll meet again tomorrow and possibly Friday if we have anything to continue on that. But it was great because we were able to, as they say, break up into rooms. So then we had smaller groups, around 5 or 6, and could discuss what was going on in our counties. So that was very worthwhile. So thank you.
Thank you, Jenny. The next item would be Dave, and you do not have a community health report.
Correct.
So thank you. So that means, Roger, you can take up as much time as you want because I know you have a big report.
Oh, I really don't. It's all written down.
It
It's
is
all-
written down, but you could share.
All sent to you. I think I'll let you read it because I don't want to speak for other people, but I do want to say that I was very impressed with Greg Barnier's presentation about wilderness outpatient program and the difficulty he and both he and Sarah are having in getting services to people, but yet they seem to be getting it done and doing it well. It's hard. It's hard to bring that kind of intensive, individualized and very personal services to people when you can't meet with them other than like this. But he's getting going with the court-ordered program for people, and I've got it in here somewhere, but it's a program for people who are in the drug court and criminal things, and it's designed for people who have a mindset and a thought pattern that has to do with crime. And so that's called the Moral Reconation Therapy Group, and that should be underway now. And he's been shadowing the St. Louis County group to better understand how that operates. So he's got that going. He says the support he's getting is phenomenal from the county. He said that drug court's going well and that the resource is valuable for the people in Cook County. He said we're lucky to live up here, which I think we all know. So we are very fortunate to have Greg, as Allison said at the end of his report. He has done very well and he continues to do very well. And Sarah, thank you for all of your help in assisting Greg and getting people to the services that they need. I know you're doing that. Flu prep is underway. Obviously, the drive-in clinics are going to be very successful based on what Rena said earlier this morning with long lines of cars snaking through the streets. Make sure you get your flu shots. They are vitally important this year. It sounds like Portage is getting all set up for theirs. If they're not already, they will be shortly. They were waiting to get the vaccine within a week or so after our last meeting. The clinic is also increasing its respiratory clinic hours because there may be cold and flu transmissions this year, and that it's gone from 3 afternoons per week to afternoons Monday through Friday. It could be expanded beyond that. So if you've got respiratory issues, the clinic is the place to go. We can get, and Kate Serbaugh said, Centers for Disease Control and Prevention are recommending people get flu vaccinations anytime now, and they will remain in effect for a longer period of time than they have in the past. So there goes your excuse, Jenny. You can go anytime.
Well, we'll see.
Okay. And Kate talked about the prescription medication availability in the new clinic pharmacy. I guess the best way to sum that up is if you're needing to have prescriptions refilled, call the refill nurse at the clinic and she will help you deal with it. They've got a wonderful setup with Silver Bay's Essentia Clinic and pharmacy, and they will be sending them up every day from Essentia. Now, one thing that they don't have available now, and they won't have in the new clinic, are the over-the-counter type things like we all like to go through the pharmacy and pick up when we're picking up meds and things. But they do have, when the pharmacy gets open, they will have a one-day availability for ordering over-the-counter medications and the usual salves and ointments and all those kinds of good things. And they go through the pharmacy, but they won't have much in stock, and you'll have to look on the shelves and then you'll have to ask for it to get it. So it seems like there might be an opening for a new business in the county. So PHHS Advisory Council is going to be held by Zoom on Tuesday, November 3rd. We decided to go ahead with the Zoom meeting, even though it is election day, because we don't need the commissioners room to hold our meeting, so it can be held for those people who do come in and vote and don't vote by mail. So November 3rd, next meeting.
Great.
That's all
Thank
I
you,
got.
Roger.
You're welcome.
Anyone have questions for Roger? That was a lot. Oh, Myron, go ahead.
Yes, just to clarify something, there was a little discussion before the meeting, but maybe for the public. And is the clinic going to schedule other flu shot opportunities other than the drive-through, if that's something that doesn't fit schedules or can't take the time to do it?
All that I can tell you is that I contacted the clinic because none of the drive-through will work for me. And so my wife and I are getting our shots at the clinic when I have an appointment anyway. So I would call the clinic and ask them. I
You
can't say-
can, Myron, you can schedule an appointment. They have on September 28th is a specific date that they have held for vaccinations.
Okay.
But if you need one and the drive-through events don't work for you, then just call and schedule. They'll set you up.
Okay, thank you.
Yeah.
Are they
Great.
publicizing that, Andrea?
I guess I'm not really sure. I think that they're still sort of in process. I think that, the demand, obviously we saw this morning, the demand is going to be pretty high. So I think they're still working through some of the details. But if I know that they will get you a flu shot if you need it. So just give them a call.
Great. Thank you. And with that, Andrea, you are up.
Perfect. So we met, or I shouldn't say we, the Mental Health Local Advisory Council met on September 8th, and we received a presentation from Rich Tunnel, who is the Rural Mental Health Coordinator from Lake Superior Community Health Center. And that was a lot of words. He presented on a grant-funded program that he facilitates. The program originally focused on farmers, but has been expanded to anyone working in the agricultural industry in our region. And the grant allows him to have the capacity to meet with people however it works for them. He can go into their homes, he can meet via Zoom at the clinic, or just wherever he can meet the person based on their needs. He is, let's see, so he said it was a very relaxed atmosphere with no limit on time to openly discuss concerns the individuals and families have in relation to creating positive well-being in their lives. So essentially it's geared towards agricultural workers, but he said that a lot of the meetings that he's had has been sort of helping the whole family. It's not just, I need help managing my mental health in relation to my job. It's, it's a whole family approach. So he is going to be sending some brochures to Commissioner Dukirk, which she is going to help distribute. And then I made there they are. I made the brochure available to the community support line volunteers. And, I'll be looking at other ways to spread that information in the community.
Andrea, can we just make note? It says supporting farmers in stressful times, but he did say for us in our community that includes loggers.
Yep. He also, in a conversation that I had with him, it could be firefighters or, any sort of, I don't really know what the word is. I guess he specifically used agriculture, but maybe outdoor jobs. I don't know, whatever. But it was really informative and it seems like a great program. Let's see, other updates. We talked about the pharmacy situation at Sawtooth Mountain Clinic, which Roger already updated on. Carly from Higher Ed said that they continue to provide resources to the community, including classes about the Google Classroom and the Seesaw and mentorship programs. We also acknowledged that September is Suicide Prevention Month, but the importance of prevention all year, obviously. So just share your love with people who need it. We also acknowledged the increased stress levels families will be experiencing while trying to create a balance between their home, work, and school life, depending on what that looks like for them. We received an agency update from Allison, similar to the one today. And there was some kudos to Carly for her Mindfulness Monday program on WTIP. Continues to be really amazing. Every other Monday at 9:30. And then we started our mission and vision planning process, which went really great, but obviously is a long process. So we'll keep plugging away at that at our next meeting.
Thanks, Andrea. Does anyone have questions for Andrea? Alrighty. And then we have healthcare planning, Ginny.
Thank you. Just a couple highlights. Lindsay from the Violence Prevention Center said that October is the Domestic Violence Awareness Month, and they normally have a candlelight vigil. And if they can do it safely, they will do it. Otherwise, they may opt for virtual on that, but they're hoping to do a in-person one. And she also said that there'll be an online advocate training coming up soon. Valerie from North Shore Healthcare Foundation said their new website is official, reviewed, renewed, and everything, and it's up and running for that foundation. And there again in September, they do the Superior National Scramble fundraiser. And so they're looking at how they can support that this year, coming up the weekend of September 25th. And that's my highlights.
Thanks, Ginny. And I did get a request for volunteers for the scramble, so they must have figured something out.
Oh, okay.
And the candlelight vigil, I hate to say, it's often cold and we're all bundled up in gloves and masks normally, so it might happen again. And then North Shore Collaborative, Dave, you have not popped up on screen, so I'm assuming that did not meet also. So we will move on. Oh, Dave, your volume's on. You're off.
I just said correct, sorry.
Thank you. And emergency preparedness, Myron.
Okay, I missed that meeting. I don't know if Dave attended or Rena, but I was unable to attend. I had a conflict.
Dave attended. What's up, Dave?
Yeah, I mean, the long and short was that, you know, Grace gave us her update. And so that was, I'd say, the bulk of, you know, that substance. But Rena, unless you wanted to throw something else, there's just good to get reports on, I guess, from the Forest Service, just an event they had at Pincushion and how that was a success and able to coordinate and do things safely. And there was a lot of cooperation there. Otherwise, just similar updates from the hospital and clinic too. So
Thanks, Dave.
we're in a basically you know, a holding pattern here with our county. So
Great. Rena, you turned on your volume.
Yeah, I was just in case I needed to add something, but it really was a quick update. It's mostly Grace. And it is interesting to me. I mean, I think we're in a good operational pattern with our response to COVID in the county. Our numbers are low And I think sometimes we're victims of our own success because our numbers are low, then people are acting like, well, why you guys keep doing this? But that's why our numbers are low. So, but it was actually a quick meeting this time because things are kind of in a good steady pattern.
Great, thank you. Does anyone have anything for the good of order?
Yes, I do.
Go
So
for it.
last month at the Schroeder Township meeting, they said that with some of the COVID money, they purchased hand sanitizers of various sizes, from a quart down to a little spray, and masks. And they went over and set up a table at the Schroeder post office. And anyone who's a Schroeder resident was able to pick up this little package of all this great stuff to use. And I happened to be down there doing something else. And so they said, well, you're our commissioner, so here, have some too. So it was a nice gesture and great use of the money that they, you had.
It was nice that they shared with you and didn't spray you with sanitizer.
I know. Before I went to the coffee shop, they did.
Excellent. Does anyone else have for the good of the order? All right, so for good
Heidi,
of the order.
Heidi, can I add a good of the order?
Absolutely.
Thanks. So I've been working with Grace Gernager at Public Health to get some t-shirts or long sleeve t-shirts for our community volunteers that registered through the Minnesota response system for the grocery stores, community support line, Ruby's Pantry, et cetera, et cetera. There'll be a press release coming out soon. But the t-shirts are here. The logo was designed by a local artist, and they're really pretty great. And we'll start distributing to those volunteers next week as a thank you. There's 210 volunteers, and we've logged thousands and thousands and thousands of volunteer hours since March. So yay for our community.
Absolutely. Thank you.
And
So, yep,
Heidi,
go ahead. This is
Ginny
awesome.
and Andrea's examples are two of the reasons why we're keeping our numbers so low. It's the willingness of this community to work together and protect ourselves, and that's pretty cool.
It is pretty cool. To move off of COVID a little bit, and just a reminder, it is Recovery Month. It is also Suicide Awareness Month, and it was just recently World Suicide Prevention Day. So always remember that you are braver than you believe, stronger than you seem, and smarter than you think, and loved more than you know. From the bottom of my heart. And again, this went out on our public health Instagram. So keep an eye on that. And truly do not forget that you are loved more than you know. Do not give up. All right, with that, I will adjourn. And Myron, we have a Zoom for our next meeting. That's a new link. So you want to just start up at 10?
Yes, we'll start about right at 10 o'clock or a minute before.
Okay,
Right.
looking forward to see you.
Thanks for the reminder, and we'll see the commissioners and Rena at that time. And thanks to the rest of you for all the great work you're doing.
Bye-bye, everyone.
Bye.
Thanks, everyone.